welcome. I'm Sharon Bogan. I'm here for Public Health Week on a Medic One rig, and I'm here with Kristen Burt, who's taken time out of your busy schedule to talk with us about being a paramedic. Thank you so much.
Of course.
So, yeah, so here we are on a rig. Some might call it an ambulance. Tell us the differences between an ambulance and a Medic One rig.
So a Medic One rig is staffed with paramedics, and we have 2 paramedics on each Medic One rig, and ambulances are typically staffed with EMTs.
Gotcha. So how long have you been doing this?
I've been a paramedic for just over 3.5 years.
Wow. And what kind of training did you have to go through to get there?
So we go through Harborview, and it's a year, just under a year of training. We start out on the rigs, I think on day 2. Wow. So we're out in the street seeing patients, and it's a great program.
Wow. Yeah. What motivated you to become a paramedic?
I was a firefighter before with the city of Renton for about 5 years, and I would work with the paramedics, quite a bit. So just kind of seeing what they were doing and how they were doing it, and kind of like, wow, that looks really cool. I want to know more about that. So I started looking into it, and got hired with King County.
Wow.
Yeah.
And what's different or interesting for you about working in King County? It sounds like you work often in the south of the county, is that right?
Yeah, so King County Medic One is basically all of South King County, and we have 9 medic units sort of spread throughout the south end, from Vashon Island all the way to Enumclaw, Renton, Kent, Auburn, Tukwila, kind of everywhere in between. So that's our sort of our geographical coverage area.
Fantastic. So here we are. I'm one of the luckiest people, at least in the eyes of my 4-year-old boy, who really wanted to be on this rig with me today. So he wanted to know what's inside a real-life ambulance. So can you show us around, show us some of the high-tech things, the lower-tech things, and what are some of the things you use most often here on the rig?
So I guess we should start. Here's our stretcher. This is where we bring the patients in when they're sick, and it's kind of nice because we can my partner and myself can be on either side working on the patient. And of course here we have gloves and oxygen. We use lots of oxygen. And let's see, what else? Blankets, of course. And then I'll show you some more stuff up here with our medicines and kind of all of our airway stuff.
Great.
And then here we have our Life Pack, which we use this on pretty much every call. This is our older model, it's Life Pack 12, but this thing is awesome. It does a little bit of everything. We can do cardiac monitoring, we can do blood pressures, pulse oximetry, we can defibrillate people in cardiac arrest, EKGs, 12-lead EKGs. So this thing is pretty cool. We use this a lot.
And do you just take this outside the minute you get on a call and carry it with you?
We take it on every call, along with usually our drug kit.
Okay.
And our airway kit sometimes.
And I've heard that King County is actually a really good place to have a heart attack, if you have to have a heart attack.
So too, yeah.
Is this part of it, or what do you think is going into that?
This is definitely a huge part of it. A lot of the fire departments carry this as well, and the AED part of it was sort of the shocking part of it. A lot of the police departments carry.
Interesting.
So the
and is it also citizens being trained?
Yeah,
have
exactly.
A high level of
so it's
training
not,
in CPR?
It's not just sort of what we do, but it starts from dispatching to first responders not being scared to jump in and do, the community members jumping in and doing CPR. And then, sometimes the fire department or the police department gets there and they shock people with their AEDs, which is great because they get there so fast. And then we also have the fire department that comes in. They do their stuff. They continue compressions and shocking people, and then we get there and do our stuff. So, and then we of course have the hospital end of it too. So it's a big system that works really well together.
Excellent. So what else can you show me about what we have up here up front?
Yeah. So over here we have some of our medications that we carry that are kind of nice up here because we can just grab them really quick. These are sort of ones that we use quite often. And then in here we have basically all of our other medicines that we use quite often. This is the Narcan that we were talking about earlier that we use quite a bit of, unfortunately.
And that's for overdose.
For overdoses, for opiate overdoses.
And you're seeing quite a bit of that?
We are, unfortunately.
But Narcan is quite effective.
It's great. It's a great drug. It works really fast.
Right.
And it's really easy to use, which is nice too.
Great.
And then over here we have kind of all of our airway management stuff, our intubation tubes and our bundle that we use, some of our fluids that we hang for patients that need fluid resuscitation. And then in here we have sort of all of our IV stuff, our IV catheters themselves. We can draw bloods in the field. So that's a drawer we use a lot.
And do you do some data gathering and research as well?
Yeah, so that's kind of one of the cool things about working in this area is we do a ton of studies. We are actually doing one right now called the sodium nitrite study, and it's in sudden cardiac arrest, and basically they're just kind of looking at improving outcomes, neurological outcomes for patients that have sudden cardiac arrest. And we're kind of constantly doing one study or another, and they're just looking at the data and trying to figure out what's the best thing for patients and the community. So it's pretty great.
Great. So share with us one kind of memorable rescue or anything that comes to mind that's really stuck with you as a paramedic.
Sure. I was actually thinking about this yesterday, and we had a patient earlier last year, a 52-year-old gentleman collapsed at home with his family. Collapsed in the other room, family heard it, fortunately, went in, started CPR, called 911. Police department got there first. They shocked him. He was in ventricular fibrillation. Fire department got there about the same time as us, and then fire department shocked him while we were kind of doing our ALS stuff, intubating, starting IVs, giving medicine. And I heard not too long after that he had a great recovery.
Wow.
Yeah.
Wow.
So that was pretty cool to hear.
Of your work.
Yeah, but it was the whole system, you know, working together from dispatching to the family members jumping in to the firefighters, police, hospitals. I mean, it was just kind of the way our system works.
Fantastic. Well, thank you for all of your expertise and your dedication. I know sometimes you work 24-hour shifts, as do other paramedics. We are so privileged to have you and your entire paramedic team working for King County. It's a great way to end Public Health Week. We've had lots of videos, Facebook Live videos this week, and you can check them all out. Feel free to subscribe to Public Health Insider, and we look forward to continuing to build collaborations across the county.
Cool. Thank you so much.
Thank you.